For years, doctors told patients with atrial fibrillation to cut out caffeine. It seemed like common sense, right? Caffeine is a stimulant, and you wouldn't want to stimulate a heart that already has an irregular rhythm. That morning cup of coffee was seen as a potential trigger for an atrial fibrillation episode. But what if that long-held medical advice isn't the whole story? A brand new clinical trial, cleverly named the DECAF trial, has just turned this entire idea on its head. Researchers wanted to find out what really happens when atrial fibrillation patients who are already regular coffee drinkers keep drinking their daily coffee. They took 200 patients who had all just had a cardioversion, a medical procedure to shock the heart back into a normal rhythm. Everyone in the study was a moderate coffee drinker, having about 1 cup a day. They were split into 2 groups. One group was told to continue their daily coffee habit, while the other was told to avoid all caffeine for the next 6 months. Now, the results were pretty shocking. The group that stopped drinking caffeine had a 64% recurrence rate, meaning their atrial fibrillation came back. But get this, the group that kept drinking their daily coffee had a recurrence rate of only 47%. That's a 40% lower risk of atrial fibrillation returning, just by sticking with their normal coffee routine. So what's going on here? Well, the researchers have a couple of ideas. First, caffeine is known to block a chemical in our bodies called adenosine, and adenosine is known to be a trigger for atrial fibrillation, so by blocking it, caffeine might actually be protecting the heart. Second, we know that coffee is packed with antioxidants and has powerful anti-inflammatory properties, which are always a good thing for your overall heart health. Now, before you go out and order the largest coffee you can find, there are a few really important things to keep in mind. This study only looked at moderate consumption. We're talking about 1 cup of regular coffee per day. This is not a green light to start drinking an entire pot. This finding also only applies to coffee. It absolutely does not apply to other high caffeine products like energy drinks, which are still a major risk and should be avoided. And it also doesn't apply to those super sugary high-fat lattes that come with their own set of health concerns. The big takeaway here is this. If you have atrial fibrillation, you already enjoy a simple, daily cup of coffee. This study suggests you probably don't need to stop. In fact, it might even be helpful. But like with everything related to your health, this is not one-size-fits-all advice. It's absolutely essential that you talk to your own doctor about your specific condition and what is right for you. Thanks for watching. And if you found this interesting, don't forget to like and subscribe for more health updates. If you would like to read the full study, the link is in the description of this video.